Another Plab2 episode with Dr. Al. I'm gonna play a game with you. I'm gonna be the patient today. I'm gonna give you a scenario and I'm gonna walk you through the thing you have to ask about, and then I'm gonna, toward the end, I'm gonna give you the diagnosis. Let's see if you can get the diagnosis right. 30-year-old man presented with tiredness. Okay, we start by asking about tiredness, alright? Any other complaints? Doctor, I feel like I'm a bit constipated recently. Constipated. Are we gonna ask about that? What are we gonna ask about constipation? So, constipation, first you need to know for how long. What do you mean? This is important. What do you mean by constipation? When was the last time you went to the toilet? Do you feel like you have to go, but it's stuck in there? You want to ask about a little bit of stool impaction. Do you feel like it's very hard for you to push? Or do you feel like there is nothing to push? Just some question about constipation to know which one of those. The most important is, what do you mean by constipation? Then I said, Doctor, I felt like I've gained some weight recently. You know, I want to ask about weight. What do you mean? How many kg? Over how long? Was it intentional? Very important. You carry on with everything else. It's negative. I have gained weight. I am constipated. I am tired. I'm losing hair. You get to the investigations. You want to verbalize, okay, I'm going to examine you right now. I'm going to check your blood pressure, your pulse, your heart rate. And I want to check your lungs, your tummy, your legs. And I might run some quick investigations like bloods. I want to do some, what else are we going to do? You want to name the bloods. I want to do full blood count, thyroid function, liver function, all the routine bloods. You get the thyroid function handed over to you, and I have hypothyroidism. How are you going to manage me? You're going to start me on levothyroxine. That is correct. Now, I ask you this question. Oh, doctor, how do I take this tablet? What is this medication? What is levothyroxine? All of these are reasonable questions you might be asked. So, you explain to the patient, we're going to start you on a tablet called levothyroxine. This is basically a hormonal replacement for the low levels of thyroxine that your thyroid gland is not producing properly. This tablet, we're gonna start low and go slow. You're gonna start on one tablet once a day. You have to take it with water, okay? If you have any other information about levothyroxine, feel free to mention. I've never had a thyroid issue, so I don't know if you're supposed to take the tablet before food, after food. If you see any information on NICE's guidelines, make sure to mention them. And then you tell the patient, we're going to escalate quickly, and you will be followed up after every escalation. Once we get to the base dose, we're going to follow you once a year, and you carry on.